Hello, nursing students. Welcome to Nursing Exam Preparation, your go-to channel for excelling in nursing exams with confidence. In today's video, we'll guide you through 150 multiple-choice questions, MCQs, on osteoarthritis, each carefully crafted to challenge your understanding and expand your knowledge of this important topic. Detailed explanations follow every question, helping you not only answer correctly, but also understand the reasoning behind each answer. Whether you're just starting your studies or reviewing for your exams, this video is packed with content to test your skills, enhance your critical thinking, and reinforce key concepts related to osteoarthritis nursing care. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more invaluable resources. Be sure to hit the bell icon to stay updated on our latest videos, all designed to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's dive in and work toward mastering osteoarthritis nursing care and achieving exam success. 1. What is the primary cause of osteoarthritis? A. Bacterial infection. B. Genetic mutations. C. Cartilage breakdown. D. Autoimmune reaction. Answer: C. Cartilage breakdown. Rationale: osteoarthritis is primarily caused by the gradual breakdown of cartilage in joints, leading to pain and stiffness. It is a degenerative joint disease, rather than one caused by infection or autoimmunity. A. Bacterial infection is more commonly associated with septic arthritis, not osteoarthritis. B. While genetic factors can contribute to osteoarthritis, cartilage breakdown is the main cause. D. Autoimmune reactions are seen in diseases like rheumatoid arthritis, not osteoarthritis. 2. Which of the following is the most significant risk factor for developing osteoarthritis? A. Young age. B. Obesity. C. High physical activity. D. Smoking. Answer: B. Obesity. Rationale: obesity is a well-established risk factor for osteoarthritis, as excess body weight increases stress on weight-bearing joints like the knees, accelerating cartilage breakdown. A. Osteoarthritis is more common in older adults, not young age. C. High physical activity may increase the risk of joint injury, but it is not the most significant risk factor. D. Smoking does not have a direct relationship with osteoarthritis, although it can impact overall joint health. 3. A patient with osteoarthritis reports joint stiffness that is worse in the morning. Which joint is most likely affected? A. Hip joint. B. Knee joint. C. Shoulder joint. D. Cervical spine. Answer: B. Knee joint. Rationale: osteoarthritis often affects weight-bearing joints such as the knees, and stiffness that is worse in the morning is a classic symptom. This is due to the lack of movement overnight, causing the joints to become stiff. A. The hip joint can be affected, but knee joints are more commonly involved with this pattern of stiffness. C. Shoulder joints can be involved, but stiffness is less prominent in the morning. D. Cervical spine involvement may cause stiffness, but it is not typically worsened in the morning. 4. Which of the following diagnostic tests is most commonly used to confirm osteoarthritis? A. X-ray. B. MRI. C. Blood tests. D. Bone scan. Answer: A. X-ray. Rationale: X-rays are the most commonly used diagnostic tool to confirm osteoarthritis, as they can reveal joint space narrowing, osteophytes, bone spurs, and other signs of cartilage degradation. B. MRI can provide more detailed images, but is usually not required for diagnosing osteoarthritis. C. Blood tests are typically normal in osteoarthritis. They are more useful for diagnosing inflammatory conditions like rheumatoid arthritis. D. Bone scans are used to detect bone activity, but are not routinely used for osteoarthritis diagnosis. 5. Which of the following treatments is most commonly used to manage the pain of osteoarthritis? A. Steroid injections. B. Non-steroidal anti-inflammatory drugs, NSAIDs. C. Antidepressants. D. Antihistamines. Answer: B. Non-steroidal anti-inflammatory drugs, NSAIDs. Rationale: NSAIDs are commonly used to manage pain and inflammation in osteoarthritis. They work by reducing the production of prostaglandins, which mediate inflammation. A. Steroid injections may be used for short-term relief of inflammation, but they are not the first-line treatment. C. Antidepressants are not used to treat pain in osteoarthritis unless there is coexisting depression. D. Antihistamines are used for allergies and do not help with osteoarthritis pain. 6. Which of the following is a typical sign of advanced osteoarthritis? A. Erythema and warmth. B. Joint deformity. C. Elevated white blood cell count. D. Fever. Answer: B. Joint deformity. Rationale: advanced osteoarthritis often leads to joint deformities due to the progression of cartilage loss, bone spurs, and changes in joint structure. A. Erythema and warmth are more indicative of inflammation, which is common in rheumatoid arthritis, not osteoarthritis. Seeing a normal or mildly elevated white blood cell count is expected in osteoarthritis. An elevated count would suggest an infection. Deep fever is not a typical feature of osteoarthritis. It is more associated with infections or inflammatory conditions. 7. Which of the following is a surgical treatment option for patients with osteoarthritis? A. Joint replacement surgery. B. Amputation. C. Spinal fusion. D. Bypass surgery. Answer: A. Joint replacement surgery. Rationale: in severe cases of osteoarthritis where conservative treatments fail, joint replacement surgery, most commonly for hips or knees, is the standard surgical treatment. B. Amputation is not a common treatment for osteoarthritis. It would be considered only in extreme, rare cases. C. Spinal fusion is used for spinal conditions, not osteoarthritis. D. Bypass surgery is used for cardiovascular diseases, not osteoarthritis. 8. Which of the following lifestyle changes can help reduce symptoms of osteoarthritis? A. Reducing body weight. B. Increased alcohol consumption. C. Decreased physical activity. D. Avoiding joint movement. Answer: A. Reducing body weight. Rationale: reducing body weight helps decrease stress on weight-bearing joints, which can alleviate the symptoms of osteoarthritis. B. Alcohol consumption does not improve osteoarthritis and may worsen symptoms. C. While rest is important, excessive physical inactivity can worsen joint stiffness and loss of function. D. Avoiding joint movement is not recommended as moderate physical activity can help improve joint mobility and strength. 9. Which joint is most commonly affected by osteoarthritis?
A. Wrist.
B. Elbow.
C. Knee.
D. Ankle. Answer: C. Knee. Rationale: the knee is one of the most commonly affected joints in osteoarthritis due to its weight-bearing function and repetitive movement. A. The wrist is less commonly affected. B. The elbow is not typically a site for osteoarthritis. D. The ankle can be affected, but the knee is more common. 10. What is a common complication of untreated or severe osteoarthritis? A. Cardiac arrhythmias. B. Chronic pain. C. Hearing loss. D. Hyperkalemia. Answer: B. Chronic pain. Rationale: chronic pain is a common complication of untreated or severe osteoarthritis, significantly affecting quality of life. 8. Cardiac arrhythmias are not directly linked to osteoarthritis. C. Osteoarthritis does not typically cause hearing loss. D. Hyperkalemia is unrelated to osteoarthritis. 11. Which of the following medications is most commonly used to reduce pain in osteoarthritis? A. Acetaminophen. B. Antibiotics. C. Beta blockers. D. Insulin. Answer: A. Acetaminophen. Rationale: acetaminophen is commonly used to relieve mild to moderate pain in osteoarthritis. It works by inhibiting pain signals in the brain. B. Antibiotics are used to treat infections, not osteoarthritis. C. Beta blockers are used for heart-related conditions. D. Insulin is used for diabetes, not osteoarthritis. 12. Which of the following lifestyle modifications can reduce the symptoms of osteoarthritis? A. Smoking cessation. B. Increased alcohol intake. C. Weight loss. D. Decreasing water intake. Answer: C. Weight loss. Rationale: weight loss reduces the stress on weight-bearing joints such as the knees, reducing symptoms of osteoarthritis. A. Smoking cessation is beneficial for overall health, but does not directly affect osteoarthritis symptoms. B. Increased alcohol intake may worsen symptoms and impact overall health. D. Decreasing water intake is not recommended and can lead to dehydration. 13. What physical therapy technique is commonly recommended for patients with osteoarthritis? A. Stretching exercises. B. Heavy weightlifting. C. High-impact aerobic exercise. D. Yoga. Answer: A. Stretching exercises. Rationale: stretching exercises can help improve joint flexibility and reduce stiffness in osteoarthritis patients. B. Heavy weightlifting may stress the joints further. C. High-impact aerobic exercises can be harmful to joints in osteoarthritis. D. Yoga may be beneficial for flexibility, but is not the most common recommendation. 14. Which of the following is an example of a joint protection technique for osteoarthritis? A. Avoiding all physical activity. B. Using assistive devices, e.g., canes. C. Applying hot compresses for 24 hours. D. Overuse of the affected joint. Answer: B. Using assistive devices, e.g., canes. Rationale: using assistive devices, such as canes or knee braces, helps to reduce strain on affected joints. A. Avoiding all physical activity can lead to further stiffness and loss of function. C. Applying hot compresses may provide temporary relief, but should not be done continuously for 24 hours. D. Overuse of the joint can worsen osteoarthritis symptoms. 15. Which of the following is the main focus of managing osteoarthritis? A. Cure the disease. B. Relieve pain and improve function. C. Prevent weight gain. D. Prevent the development of cancer. Answer: B. Relieve pain and improve function. Rationale: the primary goal in managing osteoarthritis is to relieve pain and improve joint function to enhance the patient's quality of life. A. There is no cure for osteoarthritis. C. Weight management is important but is secondary to pain and function management. D. Osteoarthritis is not linked to cancer, so preventing its development is not the focus. 16. Which of the following is the characteristic feature of osteoarthritis on X-ray? A. Bone erosion. B. Joint space narrowing. C. Soft tissue swelling. D. Bone spurs. Answer: B. Joint space narrowing. Rationale: joint space narrowing is a hallmark sign of osteoarthritis on X-ray, reflecting the loss of cartilage. A. Bone erosion is more characteristic of rheumatoid arthritis. C. Soft tissue swelling is not typically seen on X-ray in osteoarthritis. D. Bone spurs can appear, but joint space narrowing is more characteristic. 17. Which of the following is a typical symptom of osteoarthritis? A. Joint stiffness and swelling. B. Sudden onset of fever. C. Severe muscle weakness. D. Skin rashes. Answer: A. Joint stiffness and swelling. Rationale: joint stiffness and swelling, especially after inactivity, are common symptoms of osteoarthritis. B. Fever is typically seen in infections or inflammatory diseases like rheumatoid arthritis, not osteoarthritis. C. Muscle weakness is not a typical symptom of osteoarthritis. D. Skin rashes are more indicative of autoimmune diseases, not osteoarthritis. 18. Which of the following is a non-pharmacological treatment for osteoarthritis? A. Antibiotic therapy. B. Acupuncture. C. Blood transfusion. D. Chemotherapy. Answer: B. Acupuncture. Rationale: acupuncture is a non-pharmacological treatment option that may help reduce pain and improve function in osteoarthritis. A. Antibiotic therapy is used for bacterial infections, not osteoarthritis. C. Blood transfusion is not indicated in osteoarthritis. D. Chemotherapy is used for cancer treatment, not osteoarthritis. 19. What is the primary characteristic of osteoarthritis? A. Progressive cartilage degeneration. B. Systemic inflammation. C. Joint hypermobility. D. Autoimmune destruction. Answer: A. Progressive cartilage degeneration. Rationale: osteoarthritis is primarily characterized by the progressive degeneration of cartilage, leading to joint pain and stiffness. B. Systemic inflammation is more characteristic of rheumatoid arthritis. C. Joint hypermobility is not a feature of osteoarthritis. D. Osteoarthritis is not autoimmune in nature, unlike rheumatoid arthritis. 20. Which of the following factors is least likely to contribute to the development of osteoarthritis? A. Age. B. Gender. C. Obesity. D. High protein intake. Answer: D. High protein intake. Rationale: high protein intake is not a recognized risk factor for osteoarthritis. A. Age is a major risk factor, as osteoarthritis is more common in older individuals. B. Gender can influence the risk, as women are more likely to develop osteoarthritis. C. Obesity increases the risk by putting additional stress on joints. 21. What is the role of glucosamine in the management of osteoarthritis? A. It reduces inflammation. B. It improves cartilage repair. C. It provides pain relief. D. It strengthens muscles. Answer: B. It improves cartilage repair. Rationale: glucosamine is often used as a supplement to support cartilage repair and slow the progression of osteoarthritis. A. It does not directly reduce inflammation. C. It may have some mild analgesic effects, but pain relief is not its primary function. D. Glucosamine does not strengthen muscles. 22. Which of the following is an example of a pharmacological treatment for osteoarthritis? A. Methotrexate. B. Tramadol. C. Penicillin. D. Insulin. Answer: B. Tramadol. Rationale: tramadol is a medication used for moderate pain relief in osteoarthritis. A. Methotrexate is used for autoimmune conditions, not osteoarthritis. C's penicillin is used to treat bacterial infections. D. Insulin is used for diabetes management, not osteoarthritis. 23. Which joint is most affected in the hands of people with osteoarthritis? A. Metacarpophalangeal joints. B. Distal interphalangeal joints. C. Carpometacarpal joints. D. Proximal interphalangeal joints. Answer: B. Distal interphalangeal joints. Rationale: the distal interphalangeal joints, DIP, are most commonly affected in osteoarthritis of the hands. A. The metacarpophalangeal joints, MCP, are less commonly involved. C. The carpometacarpal joints are also affected, but DIP joints are more frequently involved. D. The proximal interphalangeal joints, PIP, may be involved, but DIP joints are most characteristic in osteoarthritis. 24. Which of the following interventions is appropriate for patients with knee osteoarthritis? A. Avoiding weight-bearing activities. B. Increasing joint immobilization. C. Performing low-impact exercises. D. Applying ice continuously. Answer: C. Performing low-impact exercises. Rationale: low-impact exercises, such as swimming or cycling, are beneficial for knee osteoarthritis as they improve joint mobility and strength without putting excessive strain on the joint. A. Avoiding weight-bearing activities can lead to muscle weakness and further joint deterioration. B. Joint immobilization is not recommended as it leads to further stiffness and loss of mobility. D. Ice may be used to reduce acute inflammation, but should not be applied continuously. 25. Which of the following is a primary symptom of osteoarthritis of the spine? A. Sudden severe back pain. B. Decreased range of motion. C. Inability to stand. D. Muscle spasms. Answer: B. Decreased range of motion. Rationale: decreased range of motion in the spine is a primary symptom of osteoarthritis. A. Sudden severe back pain is more common in conditions like herniated discs. C's inability to stand is not typical for osteoarthritis of the spine. D. Muscle spasms may occur but are not the primary symptom. 26. In which of the following conditions is osteoarthritis most likely to occur? A. Rheumatoid arthritis.
B. Gout.
C. Joint injury. D. Systemic lupus erythematosus. Answer: C. Joint injury. Rationale: previous joint injury or trauma increases the risk of developing osteoarthritis due to the damage caused to cartilage and surrounding tissues. A. Rheumatoid arthritis is an autoimmune condition and not related to osteoarthritis. B. Gout causes joint pain due to uric acid crystals, not osteoarthritis. D. Systemic lupus erythematosus is an autoimmune disease and does not cause osteoarthritis. 27. Which of the following is a typical sign of osteoarthritis of the hip?
A. Groin pain.
B. Shoulder pain. C. Elbow tenderness. D. Wrist stiffness. Answer: A. Groin pain. Rationale: groin pain is a common symptom of hip osteoarthritis, as the joint degeneration often affects the ball and socket structure. B. Shoulder pain is more commonly associated with shoulder conditions, not osteoarthritis of the hip. C. Elbow tenderness is not a typical symptom of hip osteoarthritis. D. Wrist stiffness is not typically seen in hip osteoarthritis. 28. Which of the following should be monitored when using NSAIDs to treat osteoarthritis pain? A. Liver function tests. B. Blood glucose levels. C. Electrolyte levels. D. White blood cell count. Answer: A. Liver function tests. Rationale: NSAIDs can affect liver function, so it is important to monitor liver enzymes, especially in long-term use. B. Blood glucose levels are important in patients with diabetes, but are not directly affected by NSAIDs. C. Electrolyte levels are not directly impacted by NSAIDs. D. White blood cell count is more relevant in infections, not osteoarthritis treatment with NSAIDs. 29. Which of the following is the role of corticosteroid injections in osteoarthritis treatment? A. To regenerate cartilage. B. To decrease joint inflammation. C. To treat the underlying cause. D. To repair joint deformities. Answer: B. To decrease joint inflammation. Rationale: corticosteroid injections are used to reduce joint inflammation and provide short-term pain relief in osteoarthritis. A. They do not regenerate cartilage. C's corticosteroids do not treat the underlying cause of osteoarthritis, only its symptoms. D. Joint deformities are not repaired by corticosteroid injections. 30. Which of the following factors is most likely to worsen the symptoms of osteoarthritis? A. Regular low-impact exercise. B. Prolonged inactivity. C. Weight management. D. Proper joint alignment. Answer: B. Prolonged inactivity. Rationale: prolonged inactivity can lead to joint stiffness and muscle weakness, worsening the symptoms of osteoarthritis. A. Regular low-impact exercise improves joint function and reduces symptoms. C. Weight management helps to reduce stress on joints and alleviate symptoms. D. Proper joint alignment is important, but not a direct factor in symptom worsening. 31. Which of the following best describes the onset of osteoarthritis? A. Sudden and severe. B. Gradual and progressive. C. Rapid with systemic symptoms. D. Acute and inflammatory. Answer: B. Gradual and progressive. Rationale: osteoarthritis typically develops gradually over time, with symptoms worsening progressively. A. Osteoarthritis does not usually have a sudden onset. C. Rapid onset with systemic symptoms is characteristic of diseases like rheumatoid arthritis, not osteoarthritis. Deep osteoarthritis is a degenerative joint disease and is not primarily inflammatory. 32. Which of the following is a common physical sign of osteoarthritis? A. Redness and heat over the joint. B. Joint instability. C. Joint deformity and bony growths. D. Pale skin. Answer: C. Joint deformity and bony growths. Rationale: joint deformity and bony growths, osteophytes, are common in osteoarthritis due to the breakdown of cartilage and bone remodeling. A. Redness and heat are more commonly seen in inflammatory conditions like rheumatoid arthritis. B. Joint instability is not typically a sign of osteoarthritis, although some loss of function may occur. D. Pale skin is not associated with osteoarthritis. 33. What is the primary function of the cartilage in osteoarthritis? A. To reduce inflammation. B. To facilitate bone growth. C. To provide a smooth surface for joint movement. D. To repair joint deformities. Answer: C. To provide a smooth surface for joint movement. Rationale: the primary function of cartilage in healthy joints is to provide a smooth, lubricated surface for joint movement, reducing friction. A. Cartilage does not directly reduce inflammation. B. Cartilage is not involved in bone growth. Deep cartilage does not repair joint deformities. Rather, it is often damaged in osteoarthritis. 34. Which of the following risk factors is most commonly associated with the development of osteoarthritis in older adults? A. Genetic mutations. B. Trauma and joint injuries. C. Decreased physical activity. D. High-fat diet. Answer: B. Trauma and joint injuries. Rationale: trauma and joint injuries are major risk factors for the development of osteoarthritis in older adults, as previous injuries can accelerate cartilage degradation. A. Genetic mutations may contribute to osteoarthritis, but are not the most significant risk factor in older adults. C. Decreased physical activity can lead to muscle weakness and joint stiffness, but joint injuries have a greater impact. D. A high-fat diet is not directly linked to osteoarthritis. 35. What is the role of physical therapy in osteoarthritis management? A. To cure the disease. B. To prevent surgery. C. To reduce pain and improve mobility. D. To stimulate bone growth. Answer: C. To reduce pain and improve mobility. Rationale: physical therapy helps reduce pain and improve mobility by strengthening the muscles around affected joints and improving flexibility. A. Physical therapy cannot cure osteoarthritis, but helps manage symptoms. B. It can help prevent surgery in some cases, but the primary role is symptom management. D. Physical therapy does not stimulate bone growth, but focuses on joint function and muscle strength. 36. Which of the following treatments is used to reduce inflammation in osteoarthritis? A. Corticosteroid injections. B. Antidepressants. C. Antihistamines. D. Anticoagulants. Answer: A. Corticosteroid injections. Rationale: corticosteroid injections are commonly used to reduce inflammation and provide short-term pain relief in osteoarthritis. B. Antidepressants are used for mood disorders, not inflammation. C. Antihistamines are used for allergies, not osteoarthritis. D. Anticoagulants are used to prevent blood clots, not to treat osteoarthritis. 37. Which of the following statements about osteoarthritis is true? A. It affects only the joints of the hands. B. It is caused by autoimmune reactions. C. It typically occurs in weight-bearing joints. D. It leads to systemic symptoms like fever. Answer: C. It typically occurs in weight-bearing joints. Rationale: osteoarthritis typically affects weight-bearing joints like the knees, hips, and spine. A. While it can affect the hands, it is not limited to them. B. Osteoarthritis is not an autoimmune disease. It is a degenerative joint disease. D. Systemic symptoms like fever are not typical of osteoarthritis. 38. What is the role of weight loss in the management of osteoarthritis? A. To cure the disease. B. To reduce stress on joints. C. To stimulate cartilage growth. D. To increase bone density. Answer: B. To reduce stress on joints. Rationale: weight loss helps reduce stress on weight-bearing joints, such as the knees and hips, alleviating symptoms of osteoarthritis. A. Weight loss cannot cure osteoarthritis, but it can significantly improve symptoms. C. Weight loss does not stimulate cartilage growth. D. Weight loss does not directly increase bone density, although it may improve overall joint function. 39. Which of the following is a common finding in the joints of patients with osteoarthritis? A. Soft tissue swelling. B. Joint instability. C. Osteophytes, bone spurs. D. Synovial fluid accumulation. Answer: C. Osteophytes, bone spurs. Rationale: osteophytes, bone spurs, are common findings in osteoarthritis and form due to the body's attempt to repair damaged bone. A. Soft tissue swelling is more commonly seen in inflammatory conditions like rheumatoid arthritis. B. Joint instability is not a characteristic of osteoarthritis. However, joint stiffness and pain can occur. D. Synovial fluid accumulation is usually seen in inflammatory arthritis, not osteoarthritis. 40. Which of the following is most commonly prescribed for short-term pain relief in osteoarthritis? A. Acetaminophen. B. Opioids. C. Aspirin. D. Anticoagulants. Answer: A. Acetaminophen. Rationale: Acetaminophen is commonly used for short-term pain relief in osteoarthritis due to its mild analgesic properties. B. Opioids are not typically prescribed for osteoarthritis due to their risk of dependency and side effects. C. Aspirin may be used for pain relief, but is less commonly prescribed due to potential gastrointestinal side effects. D. Anticoagulants are used for blood clot prevention, not pain relief in osteoarthritis. 41. What is the impact of osteoarthritis on joint cartilage? A. It becomes thicker. B. It regenerates. C. It deteriorates and wears away. D. It calcifies. Answer: C. It deteriorates and wears away. Rationale: in osteoarthritis, the cartilage deteriorates and wears away, leading to increased friction between bones, causing pain and stiffness. A. Cartilage does not become thicker in osteoarthritis. It thins and degenerates. B's cartilage does not regenerate in osteoarthritis, though some treatments may attempt to stimulate cartilage repair. D. Cartilage does not calcify in osteoarthritis. 42. What type of joint is most commonly affected by osteoarthritis in the fingers? A. Hinge joints. B. Ball and socket joints. C. Saddle joints. D. Distal interphalangeal joints, DIP. Answer: D. Distal interphalangeal joints, DIP. Rationale: the distal interphalangeal joints, DIP, in the fingers are most commonly affected by osteoarthritis, leading to characteristic bony enlargements, Heberden's nodes. A. Hinge joints, e.g., knees, elbows, are commonly affected by osteoarthritis, but not in the fingers. B. Ball and socket joints are less commonly affected in the fingers. C. Saddle joints are found in the thumb, but are not the most commonly affected by osteoarthritis. 43. Which of the following can contribute to the progression of osteoarthritis? A. Joint immobilization. B. Weight loss. C. Physical activity and exercise. D. Joint protection devices. Answer: A. Joint immobilization. Rationale: joint immobilization can lead to muscle atrophy, increased stiffness, and further joint degradation, contributing to the progression of osteoarthritis. B. Weight loss helps reduce stress on joints and is beneficial. C. Physical activity and exercise, when done correctly, help maintain joint function and reduce symptoms. D. Joint protection devices, e.g., braces, canes, help prevent further damage and manage symptoms. 44. What is a common symptom of hip osteoarthritis? A. Sudden severe groin pain. B. Pain in the shoulder. C. Pain in the lower back. D. Pain with weight-bearing activities. Answer: D. Pain with weight-bearing activities. Rationale: hip osteoarthritis typically causes pain with weight-bearing activities, such as walking or standing. A. Sudden severe groin pain is less common. Pain usually develops gradually. B. Pain in the shoulder is not typical of hip osteoarthritis. C's lower back pain may occur as a secondary symptom, but is not the primary symptom of hip osteoarthritis. 45. What is the primary effect of osteoarthritis on synovial fluid? A. It becomes thicker and less viscous. B. It becomes more viscous and abundant. C. It regenerates. D. It is completely absent in osteoarthritis. Answer: A. It becomes thicker and less viscous. Rationale: in osteoarthritis, synovial fluid becomes thicker and less viscous, which reduces its ability to lubricate the joint properly, leading to increased friction and pain. B. Synovial fluid does not become more viscous in osteoarthritis. It often decreases in volume and quality. C. Synovial fluid does not regenerate in osteoarthritis. D. Synovial fluid is not absent in osteoarthritis. It just becomes less effective. 46. Which of the following treatments is often used for pain relief in osteoarthritis of the knee? A. Hyaluronic acid injections. B. Insulin injections. C. Antibiotic therapy. D. Blood pressure medication. Answer: A. Hyaluronic acid injections. Rationale: hyaluronic acid injections are used in knee osteoarthritis to provide lubrication and improve joint function, helping to reduce pain. B. Insulin injections are used to manage diabetes, not osteoarthritis. C's antibiotics are used for infections, not for osteoarthritis. D. Blood pressure medication is not used for pain relief in osteoarthritis. 47. Which of the following is a common complication of long-standing osteoarthritis? A. Joint deformity. B. Severe swelling.
C. Sepsis.
D. Low blood pressure. Answer: A. Joint deformity. Rationale: joint deformity is a common complication of long-standing osteoarthritis due to progressive cartilage degradation and bone remodeling. B. Severe swelling is not typical of osteoarthritis and is more associated with inflammatory conditions. C. Sepsis is a systemic infection, not a complication of osteoarthritis. Deep low blood pressure is not a complication of osteoarthritis. 48. Which of the following is the most common site for osteoarthritis in the spine? A. Cervical spine. B. Thoracic spine. C. Lumbar spine. D. Sacral spine. Answer: C. Lumbar spine. Rationale: the lumbar spine, lower back, is the most common site for osteoarthritis in the spine due to the high mechanical load it bears. A. The cervical spine, neck, can also be affected but is less common. B. The thoracic spine is less commonly affected by osteoarthritis. D. The sacral spine is less commonly involved in osteoarthritis. 49. What is the primary cause of pain in osteoarthritis? A. Cartilage regeneration. B. Muscle weakness. C. Inflammation of synovium. D. Joint cartilage breakdown. Answer: D. Joint cartilage breakdown. Rationale: pain in osteoarthritis is primarily due to the breakdown of cartilage, leading to increased friction between bones. A. Cartilage does not regenerate in osteoarthritis. Rather, it degenerates. B. Muscle weakness may occur, but it is not the primary cause of pain. C. Inflammation of the synovium occurs in osteoarthritis, but it is not as prominent as the breakdown of cartilage. 50. Which of the following is a common non-pharmacological treatment for osteoarthritis? A. Physical therapy. B. Antidepressants. C. Antibiotics. D. Blood pressure medication. Answer: A. Physical therapy. Rationale: physical therapy is a common non-pharmacological treatment for osteoarthritis, helping to reduce pain, improve mobility, and strengthen muscles around the joint. B. Antidepressants are used for mood disorders, not osteoarthritis. C. Antibiotics are used to treat infections, not osteoarthritis. D. Blood pressure medications are unrelated to the management of osteoarthritis. 51. Which of the following is a modifiable risk factor for osteoarthritis? A. Age. B. Genetics. C. Obesity. D. Gender. Answer: C. Obesity. Rationale: obesity is a modifiable risk factor for osteoarthritis, as excess weight puts additional stress on weight-bearing joints, increasing the risk of cartilage damage. A. Age is a non-modifiable risk factor. B. Genetics can increase the risk, but is not modifiable. D. Gender is a non-modifiable risk factor, with women being more prone to osteoarthritis, particularly after menopause. 52. Which of the following joint types is most commonly affected by osteoarthritis? A. Hinge joints. B. Ball and socket joints. C. Pivot joints. D. Saddle joints. Answer: A. Hinge joints. Rationale: hinge joints, such as the knees, elbows, and fingers, are commonly affected by osteoarthritis due to the mechanical stress placed on them during daily activities. B. Ball and socket joints, e.g., hip, shoulder, can also be affected but less commonly than hinge joints. C. Pivot joints, e.g., neck, are less commonly affected. D. Saddle joints, e.g., thumb, are involved, but hinge joints are more commonly affected by osteoarthritis. 53. What is the role of NSAIDs in the treatment of osteoarthritis? A. To regenerate cartilage. B. To reduce pain and inflammation. C. To cure the disease. D. To replace damaged cartilage. Answer: B. To reduce pain and inflammation. Rationale: NSAIDs are used to reduce pain and inflammation in osteoarthritis by inhibiting the production of prostaglandins, which are involved in the inflammatory process. A. NSAIDs do not regenerate cartilage. C. NSAIDs do not cure osteoarthritis, but they manage symptoms. DEEP NSAIDs do not replace damaged cartilage. They only relieve symptoms. 54. Which of the following tests is commonly used to diagnose osteoarthritis? A. MRI. B. Chest X-ray. C. Joint aspiration. D. Electrocardiogram, ECG. Answer: A. MRI. Rationale: MRI is commonly used to diagnose osteoarthritis as it provides detailed images of soft tissues, cartilage, and joint structures. B. Chest X-rays are used to assess the lungs and heart, not osteoarthritis. C. Joint aspiration is used for joint fluid analysis, typically to rule out infection or gout. D. An electrocardiogram, ECG, is used to assess heart function, not osteoarthritis. 55. Which of the following is the most common symptom of osteoarthritis? A. Swollen joints. B. Joint pain. C. Muscle spasms. D. Fever. Answer: B. Joint pain. Rationale: joint pain is the most common symptom of osteoarthritis, often exacerbated by movement or weight-bearing activities. A. Swollen joints are more commonly associated with inflammatory conditions like rheumatoid arthritis. C. Muscle spasms can occur but are not a primary symptom of osteoarthritis. D. Fever is not a typical symptom of osteoarthritis. 56. Which of the following interventions is most appropriate for patients with osteoarthritis of the knee? A. Knee replacement surgery. B. Corticosteroid injections. C. Complete bed rest. D. Strength training with heavy weights. Answer: B's corticosteroid injections. Rationale: corticosteroid injections are commonly used to provide short-term relief of pain and inflammation in knee osteoarthritis. A. Knee replacement surgery is a last resort option for severe osteoarthritis. C's complete bed rest is not recommended, as it can worsen joint stiffness and muscle weakness. D. Strength training with heavy weights is not recommended. Low-impact exercises are preferred. 57. Which of the following is a characteristic feature of osteoarthritis on an X-ray? A. Joint space narrowing. B. Increased bone density. C. Elevated white blood cell count. D. Fluid-filled cysts in the joint. Answer: A. Joint space narrowing. Rationale: joint space narrowing is a characteristic feature of osteoarthritis on X-ray, indicating the loss of cartilage between bones. B's osteoarthritis is associated with decreased, not increased, bone density. C's elevated white blood cell count is more indicative of infection or inflammation, not osteoarthritis. D. Fluid-filled cysts, e.g., Baker cysts, can occur but are not a primary feature of osteoarthritis. 58. Which of the following medications is typically used as a first-line treatment for osteoarthritis pain? A. Opioids. B. Acetaminophen. C. Antibiotics. D. Antidepressants. Answer: B. Acetaminophen. Rationale: acetaminophen is typically used as a first-line treatment for osteoarthritis pain due to its safety profile and effectiveness in mild to moderate pain. A. Opioids are not first-line due to their risk of dependency and side effects. C's antibiotics are used for infections, not osteoarthritis. D. Antidepressants may be used for mood disorders, but are not first-line for osteoarthritis pain management. 59. Which of the following is an example of a non-pharmacological intervention for osteoarthritis? A. Hydrotherapy. B. Statins. C. Antihistamines. D. Proton pump inhibitors. Answer: A. Hydrotherapy. Rationale: hydrotherapy is a non-pharmacological treatment for osteoarthritis that can help improve joint mobility, strength, and reduce pain in a warm water environment. B. Statins are used to lower cholesterol and are unrelated to osteoarthritis management. C. Antihistamines are used for allergies, not osteoarthritis. D. Proton pump inhibitors are used for acid reflux, not osteoarthritis. 60. Which of the following factors is most likely to accelerate the progression of osteoarthritis? A. Regular exercise. B. Smoking. C. Weight loss. D. Proper joint alignment. Answer: B. Smoking. Rationale: smoking can accelerate the progression of osteoarthritis by impairing blood circulation to the joints and affecting healing. A. Regular exercise, especially low impact, can help maintain joint function and reduce symptoms. C. Weight loss reduces stress on joints and can alleviate symptoms. D. Proper joint alignment is beneficial, but does not accelerate disease progression. 61. What type of joint is most affected by osteoarthritis in the hands? A. Hinge joints. B. Ball and socket joints. C. Distal interphalangeal joints.
D. Pivot joints.
Answer. C. Distal interphalangeal joints. Rationale. The distal interphalangeal joints, DIP, located at the tips of the fingers, are most commonly affected by osteoarthritis in the hands. A. Hinge joints, e.g., knees, elbows, are commonly affected but not in the hands. B. Ball and socket joints, e.g., shoulders, hips, are less commonly affected in the hands. D. Pivot joints are not typically involved in osteoarthritis in the hands. 62. Which of the following is a major goal of treatment in osteoarthritis? A. Cartilage regeneration. B. Pain relief and functional improvement. C. Cure of the disease. D. Bone growth stimulation. Answer. B. Pain relief and functional improvement. Rationale. The main goals of osteoarthritis treatment are to alleviate pain and improve joint function, allowing patients to maintain an active lifestyle. A. Cartilage regeneration is not possible in osteoarthritis, though some treatments attempt to slow progression. C. Osteoarthritis is a chronic condition with no cure. D. Bone growth stimulation is not a primary goal in osteoarthritis treatment. 63. Which of the following is a potential complication of long-term NSAID use in osteoarthritis? A. Liver damage. B. Increased bone density. C. Decreased blood pressure. D. Joint healing. Answer. A. Liver damage. Rationale. Long-term use of NSAIDs can lead to liver damage, particularly with high doses or in patients with pre-existing liver conditions. B. NSAIDs do not increase bone density. In fact, they may contribute to bone loss if used long-term. C. NSAIDs do not lower blood pressure. D. NSAIDs do not promote joint healing but are used for symptom management. 64. Which of the following surgical options is typically reserved for advanced osteoarthritis when other treatments fail? A. Arthroscopy. B. Joint fusion. C. Joint replacement. D. Cartilage repair. Answer. C. Joint replacement. Rationale. Joint replacement surgery, particularly hip or knee replacement, is typically reserved for advanced osteoarthritis when other treatments no longer provide relief. Arthroscopy may be used in earlier stages for diagnostic or minor repairs, but is not a definitive treatment. B. Joint fusion is an option for severe joint damage, but is less common than joint replacement. D. Cartilage repair is not a standard surgical option in osteoarthritis. 65. What is the effect of osteoarthritis on the synovial membrane? A. Increased lubrication. B. Thickening and inflammation. C. Complete loss of synovial fluid. D. Cartilage growth. Answer. B. Thickening and inflammation. Rationale. In osteoarthritis, the synovial membrane thickens and becomes inflamed, contributing to joint pain and stiffness. A. Osteoarthritis does not increase lubrication but rather reduces the effectiveness of synovial fluid. C's. Osteoarthritis does not cause complete loss of synovial fluid, though its quality may be reduced. D's. Cartilage growth does not occur in osteoarthritis. Instead, cartilage degeneration is the hallmark. 66. Which of the following is a common complaint of patients with osteoarthritis in the morning? A. Joint stiffness. B. Fever. C. Fatigue. D. Joint swelling. Answer. A. Joint stiffness. Rationale. Joint stiffness, particularly in the morning or after periods of inactivity, is a common complaint in patients with osteoarthritis due to decreased synovial fluid and cartilage damage. B. Fever is not typical of osteoarthritis and suggests an inflammatory or infectious process. C. Fatigue can occur but is not a hallmark of osteoarthritis. D. Joint swelling is less common in osteoarthritis than in inflammatory conditions like rheumatoid arthritis. 67. Which of the following types of exercise is most recommended for osteoarthritis patients? A. High-impact aerobics. B. Strength training with heavy weights. C. Swimming and walking. D. Jumping exercises. Answer: C. Swimming and walking. Rationale: swimming and walking are low-impact exercises that help improve joint mobility, strength, and overall function without placing excessive stress on the joints. A. High-impact aerobics may aggravate osteoarthritis symptoms due to the stress placed on the joints. B. Strength training with heavy weights is not typically recommended for osteoarthritis patients due to the potential for joint strain. D. Jumping exercises are not recommended because they increase impact on the joints. 68. Which of the following is a non-invasive intervention that can improve joint function in osteoarthritis? A. Joint replacement. B. TENS therapy. C. Cartilage transplant. D. Hip fusion surgery. Answer: B. TENS therapy. Rationale: TENS, transcutaneous electrical nerve stimulation therapy, is a non-invasive intervention that can help reduce pain and improve joint function in osteoarthritis patients. A. Joint replacement is an invasive surgery, not a non-invasive intervention. C. Cartilage transplant is not commonly done in osteoarthritis. Deep hip fusion surgery is an invasive procedure, not non-invasive. 69. Which of the following is a typical radiological feature of osteoarthritis? A. Soft tissue swelling. B. Joint space narrowing. C. Bone fracture. D. Hyperdense joint fluid. Answer: B. Joint space narrowing. Rationale: joint space narrowing is a hallmark feature of osteoarthritis on radiographs, indicating cartilage loss. A. Soft tissue swelling can occur but is more common in inflammatory conditions. C. Bone fractures are not characteristic of osteoarthritis unless there is trauma. D. Hyperdense joint fluid is not typically associated with osteoarthritis. It suggests other conditions like infection or inflammation. 70. Which of the following interventions is most likely to improve mobility in osteoarthritis patients? A. Bed rest. B. Weight loss. C. Joint immobilization. D. Opioid pain medication. Answer: B. Weight loss. Rationale: weight loss helps reduce stress on weight-bearing joints like the knees, improving mobility and reducing symptoms in osteoarthritis. A. Bed rest may worsen joint stiffness and reduce mobility. C. Joint immobilization is not recommended in osteoarthritis as it leads to further stiffness. D. Opioid pain medication is not a long-term solution for improving mobility and has significant side effects. 71. What is the most common joint involved in osteoarthritis of the hand? A. Metacarpophalangeal joint. B. Distal interphalangeal joint. C. Carpometacarpal joint. D. Proximal interphalangeal joint. Answer: B. Distal interphalangeal joint. Rationale: the distal interphalangeal (DIP) joints, located at the tips of the fingers, are most commonly affected by osteoarthritis. A. The metacarpophalangeal (MCP) joint is less commonly affected in hand osteoarthritis. C. The carpometacarpal (CMC) joint, especially the thumb, is another common site but is less frequent than the DIP joints. D. The proximal interphalangeal (PAP) joint is also affected but less commonly than the DIP joint in osteoarthritis of the hand. 72. Which of the following lifestyle modifications is most beneficial for osteoarthritis management? A. Smoking cessation. B. High-impact exercise. C. Increased alcohol consumption. D. Sedentary lifestyle. Answer: A. Smoking cessation. Rationale: smoking cessation is beneficial because smoking contributes to poor circulation and can worsen osteoarthritis symptoms. B. High-impact exercise can worsen joint damage. C. Increased alcohol consumption does not benefit osteoarthritis and may even interfere with medication. D. A sedentary lifestyle can worsen joint stiffness and mobility in osteoarthritis. 73. Which of the following symptoms of osteoarthritis is most likely to worsen throughout the day? A. Joint stiffness. B. Joint warmth. C. Fatigue. D. Joint pain. Answer: D. Joint pain. Rationale: joint pain tends to worsen throughout the day due to increased use and weight-bearing activities. A. Joint stiffness is often worse in the morning or after periods of inactivity. B. Joint warmth is not a typical feature of osteoarthritis and is more common in inflammatory conditions. C. Fatigue may occur but is not specific to osteoarthritis and may not worsen throughout the day. 74. What is the most common age group for developing osteoarthritis? A. Adolescents. B. Young adults. C. Middle-aged adults. D. Older adults. Answer: D. Older adults. Rationale: osteoarthritis is most common in older adults due to the cumulative wear and tear on joints over time. A. Osteoarthritis is not typically seen in adolescents. B. While osteoarthritis can develop in young adults, it is more common in older adults. C. Middle-aged adults are at risk, but the prevalence increases significantly with age. 75. Which of the following is a characteristic feature of osteoarthritis that distinguishes it from rheumatoid arthritis? A. Morning stiffness lasting more than 1 hour. B. Symmetrical joint involvement. C. Joint involvement with minimal inflammation. D. Fever and malaise. Answer: C. Joint involvement with minimal inflammation. Rationale: osteoarthritis is characterized by minimal inflammation and is often localized to specific joints, whereas rheumatoid arthritis is more systemic and involves more significant inflammation. A. Morning stiffness lasting more than 1 hour is typical of rheumatoid arthritis, not osteoarthritis. B. Osteoarthritis typically affects joints asymmetrically, unlike rheumatoid arthritis. D. Fever and malaise are more characteristic of inflammatory diseases like rheumatoid arthritis. 76. What is the most effective form of exercise for osteoarthritis patients who are overweight? A. Running. B. Swimming or water aerobics. C. Jumping rope. D. High-intensity interval training, HIIT. Answer: B. Swimming or water aerobics. Rationale: swimming or water aerobics is an effective form of exercise for overweight patients with osteoarthritis, as it provides low-impact exercise that reduces joint stress while improving cardiovascular health and mobility. A. Running can aggravate joint pain in osteoarthritis patients, especially those who are overweight. C. Jumping rope is a high-impact activity that may exacerbate symptoms. D. High-intensity interval training, HIIT, is often too intense for osteoarthritis patients and may increase joint stress. 77. Which of the following is a common complication of untreated osteoarthritis? A. Joint deformity. B. Stroke. C. Liver failure. D. Rheumatoid nodules. Answer: A. Joint deformity. Rationale: untreated osteoarthritis can lead to joint deformities as the cartilage degenerates and the bones may shift or develop spurs. B. Stroke is not a typical complication of osteoarthritis. C. Liver failure is unrelated to osteoarthritis. D. Rheumatoid nodules are associated with rheumatoid arthritis, not osteoarthritis. 78. Which of the following laboratory findings is typically normal in osteoarthritis? A. Elevated C-reactive protein. B. Elevated erythrocyte sedimentation rate, ESR. C. Normal white blood cell count. D. Positive rheumatoid factor. Answer: C. Normal white blood cell count. Rationale: in osteoarthritis, laboratory tests typically show normal white blood cell counts, as the condition is not associated with systemic inflammation. A. Elevated C-reactive protein and B. Elevated ESR are more typical of inflammatory conditions like rheumatoid arthritis. D. A positive rheumatoid factor suggests rheumatoid arthritis, not osteoarthritis. 79. What is the first-line pharmacological treatment for osteoarthritis pain management? A. NSAIDs, non-steroidal anti-inflammatory drugs. B. Opioids. C. Antidepressants. D. Steroids. Answer: A. NSAIDs, non-steroidal anti-inflammatory drugs. Rationale: NSAIDs are the first-line treatment for pain management in osteoarthritis as they reduce pain and inflammation. B. Opioids are not recommended as first-line due to their addictive potential and side effects. C's antidepressants may be used for pain management in some chronic conditions, but are not first-line for osteoarthritis. D. Steroids are typically used as second-line treatment, not first-line. 80. Which of the following is a risk factor for developing osteoarthritis in the knees? A. Running marathons. B. Obesity. C. Drinking alcohol. D. Taking oral contraceptives. Answer: B. Obesity. Rationale: obesity is a significant risk factor for developing osteoarthritis, especially in the knees, as excess body weight increases joint stress. A. While running may increase joint stress, it is not as significant a risk factor as obesity. C. Drinking alcohol is not a direct risk factor for osteoarthritis. D. Taking oral contraceptives does not increase the risk of osteoarthritis. 81. Which of the following is a goal of physical therapy in osteoarthritis management? A. Complete joint restoration. B. Pain relief and joint function improvement. C. Muscle atrophy. D. Complete immobility. Answer: B. Pain relief and joint function improvement. Rationale: the goal of physical therapy is to reduce pain and improve joint function through strengthening, flexibility exercises, and joint protection techniques. A. Physical therapy cannot restore cartilage. C. Muscle atrophy is the opposite of the goal in physical therapy. Strengthening muscles is key. D. Immobility is avoided in physical therapy for osteoarthritis, as it can worsen symptoms. 82. Which of the following is a characteristic of osteoarthritis that is not typically seen in rheumatoid arthritis? A. Symmetrical joint involvement. B. Cartilage degeneration. C. Systemic involvement. D. Joint deformities. Answer: B. Cartilage degeneration. Rationale: cartilage degeneration is characteristic of osteoarthritis, while rheumatoid arthritis primarily involves synovial inflammation and systemic effects. A. Symmetrical joint involvement is typical of rheumatoid arthritis. C. Systemic involvement, e.g., fever, fatigue, is more common in rheumatoid arthritis. D. Both osteoarthritis and rheumatoid arthritis can cause joint deformities, but the mechanism differs. 83. Which of the following is the most common site of osteoarthritis in the lower extremity? A. Hips. B. Knees. C. Ankles. D. Toes. Answer: B. Knees. Rationale: the knees are the most common site of osteoarthritis in the lower extremity due to their weight-bearing role. A. The hips are commonly affected but less so than the knees. C. The ankles are less frequently affected. D. Osteoarthritis can affect the toes, but is less common than knee involvement. 84. What is the purpose of using hyaluronic acid injections in osteoarthritis treatment? A. To regenerate cartilage. B. To lubricate the joint and reduce pain. C. To cure the disease. D. To replace bone tissue. Answer: B. To lubricate the joint and reduce pain. Rationale: hyaluronic acid injections are used to lubricate the joint, improving mobility and reducing pain in osteoarthritis. A. Hyaluronic acid does not regenerate cartilage. C. Hyaluronic acid injections do not cure osteoarthritis, but provide symptom relief. D. Hyaluronic acid does not replace bone tissue. 85. What is a common finding on the physical examination of a patient with knee osteoarthritis? A. Erythema and warmth. B. Crepitus and joint tenderness. C. Elevated temperature. D. Decreased range of motion. Answer: B. Crepitus and joint tenderness. Rationale: crepitus, a grating sound or sensation, and joint tenderness are common findings in knee osteoarthritis due to cartilage damage. Age, erythema, and warmth are more typical of inflammatory arthritis. C's elevated temperature is not a common finding in osteoarthritis. D. Decreased range of motion is common, but crepitus and tenderness are more specific signs. 86. Which of the following is true about the pathophysiology of osteoarthritis? A. Cartilage degeneration leads to bone-on-bone contact. B. Synovial fluid production increases significantly. C's inflammation is the primary cause of symptoms. D. Joint swelling occurs only in early stages. Answer: A. Cartilage degeneration leads to bone-on-bone contact. Rationale: in osteoarthritis, cartilage degenerates, leading to direct bone contact, which causes pain and inflammation. B. Synovial fluid production decreases in osteoarthritis, not increases. C's inflammation is secondary to cartilage degradation, not the primary cause of symptoms. D. Joint swelling is not typically a prominent feature in osteoarthritis, especially in early stages. 87. Which of the following joint treatments for osteoarthritis involves the use of an external device? A. Total knee replacement. B. Knee braces. C. Synovial fluid injections. D. Joint fusion. Answer: B. Knee braces. Rationale: knee braces are used as a conservative treatment for osteoarthritis to provide support, reduce pain, and stabilize the joint. A. Total knee replacement is an invasive surgical procedure, not an external device. C. Synovial fluid injections are used to improve lubrication but are not external devices. D. Joint fusion is a surgical procedure, not an external device. 88. Which of the following factors can exacerbate osteoarthritis symptoms? A. Regular physical activity. B. Extreme weather conditions. C. Weight management. D. Maintaining a healthy diet. Answer: B. Extreme weather conditions. Rationale: extreme weather conditions, such as cold and damp weather, can exacerbate osteoarthritis symptoms by increasing joint stiffness and discomfort. A. Regular physical activity is beneficial for managing osteoarthritis. C. Weight management helps reduce joint stress and alleviate symptoms. D. Maintaining a healthy diet supports overall health and joint function. 89. Which of the following medications is most commonly used to manage osteoarthritis-related pain? A. Aspirin. B. Acetaminophen. C. Methotrexate. D. Penicillin. Answer: B. Acetaminophen. Rationale: acetaminophen is commonly used as a first-line treatment for pain in osteoarthritis due to its effectiveness and safety profile. H. Aspirin is a non-steroidal anti-inflammatory drug, NSAID, but it is less commonly used for osteoarthritis pain than acetaminophen. C. Methotrexate is used for rheumatoid arthritis and other autoimmune conditions, not osteoarthritis. D. Penicillin is an antibiotic and is unrelated to osteoarthritis. 90. Which of the following is a potential side effect of long-term NSAID use in osteoarthritis treatment? A. Gastric ulcers. B. Increased bone density. C. Joint stiffness. D. Muscle spasms. Answer: A. Gastric ulcers. Rationale: long-term NSAID use can lead to gastric ulcers, as these medications reduce prostaglandin production, which protects the stomach lining. B. NSAIDs do not increase bone density. C. Joint stiffness is a common symptom of osteoarthritis, but is not a side effect of NSAIDs. D. Muscle spasms are not a typical side effect of NSAIDs. 91. What is a characteristic feature of osteoarthritis on MRI scans? A. Synovial fluid accumulation. B. Cartilage thinning and joint space narrowing. C. Bone fractures. D. Joint effusion with elevated white blood cells. Answer: B's cartilage thinning and joint space narrowing. Rationale: MRI typically reveals cartilage thinning, joint space narrowing, and sometimes bone spurs in osteoarthritis. 8. Synovial fluid accumulation is more common in inflammatory conditions, such as rheumatoid arthritis. C. Bone fractures are not characteristic of osteoarthritis unless there is trauma. D. Joint effusion with elevated white blood cells is more indicative of infection or inflammatory arthritis. 92. Which of the following is most often associated with osteoarthritis of the hip joint? A. Pain during rest. B. Decreased range of motion and pain with weight bearing. C. Systemic symptoms such as fever. D. Redness and warmth in the joint. Answer: B. Decreased range of motion and pain with weight bearing. Rationale: osteoarthritis of the hip typically presents with decreased range of motion and pain during weight-bearing activities, such as walking or climbing stairs. A. Pain at rest is less common and may be more associated with advanced stages. C. Systemic symptoms such as fever are not characteristic of osteoarthritis, but are seen in inflammatory arthritis. D. Redness and warmth are uncommon in osteoarthritis and suggest inflammation, which is more characteristic of rheumatoid arthritis. 93. Which of the following is most commonly used to diagnose osteoarthritis? A. X-ray. B. Blood test for rheumatoid factor. C. Bone biopsy. D. Joint aspiration. Answer: A. X-ray. Rationale: X-rays are the most common and effective imaging tool to diagnose osteoarthritis, showing features like joint space narrowing, bone spurs, and subchondral sclerosis. B. Blood tests for rheumatoid factor are used to diagnose rheumatoid arthritis, not osteoarthritis. C's. Bone biopsy is not typically used to diagnose osteoarthritis. D. Joint aspiration may be done to rule out infection or other causes, but it is not used to diagnose osteoarthritis. 94. What is the primary pathological process involved in osteoarthritis? A. Synovial inflammation. B. Cartilage degeneration and bone remodeling. C. Autoimmune attack on synovial tissues. D. Infection in the joint. Answer: B's. Cartilage degeneration and bone remodeling. Rationale: the primary pathology of osteoarthritis involves the gradual degeneration of cartilage and changes in the underlying bone, leading to joint pain and stiffness. A. Synovial inflammation is more characteristic of inflammatory arthritis, such as rheumatoid arthritis. C. Autoimmune attack is not involved in osteoarthritis. D. Infection in the joint is more characteristic of septic arthritis. 95. Which of the following is a non-pharmacologic intervention for managing osteoarthritis? A. Acupuncture. B. Corticosteroid injections. C. Antibiotic therapy. D. Disease-modifying antirheumatic drugs, DMARDs. Answer: A. Acupuncture. Rationale: acupuncture is a non-pharmacologic intervention that some patients find helpful for managing osteoarthritis pain. B's. Corticosteroid injections are pharmacologic treatments and may be used in certain cases, but are not a non-pharmacologic intervention. C. Antibiotic therapy is not used in osteoarthritis, as it is not an infectious condition. D. DMARDs are used for inflammatory arthritis, not osteoarthritis. 96. Which of the following supplements is commonly used to support joint health in osteoarthritis? A. Glucosamine and chondroitin. B. Vitamin C, siege iron supplements. D. Vitamin D. Answer: A. Glucosamine and chondroitin. Rationale: glucosamine and chondroitin are commonly used as supplements to support joint health in osteoarthritis by helping maintain cartilage structure. B. Vitamin C is important for general health, but does not directly support joint health in osteoarthritis. C's. Iron supplements are used for iron deficiency, but not for osteoarthritis. D. Vitamin D is important for bone health, but does not directly treat osteoarthritis symptoms. 97. What is the primary goal of surgical treatment for osteoarthritis? A. Complete joint regeneration. B. Pain relief and improved function. C. Bone growth stimulation. D. Eliminate the need for medication. Answer: B. Pain relief and improved function. Rationale: the primary goal of surgical treatment, such as joint replacement, is to alleviate pain and improve joint function, particularly in advanced cases of osteoarthritis. A. Complete joint regeneration is not possible with surgery. C. Bone growth stimulation is not the primary goal. D. While surgery may reduce the need for medication, this is not the main goal. 98. Which of the following is a common symptom of knee osteoarthritis? A. Redness and warmth. B. Pain and stiffness, especially in the morning. C. Systemic malaise. D. Joint deformity in the early stages. Answer: B. Pain and stiffness, especially in the morning. Rationale: pain and stiffness, especially in the morning or after periods of inactivity, are common symptoms of knee osteoarthritis. A. Redness and warmth are more characteristic of inflammatory conditions. C. Systemic malaise is not common in osteoarthritis and is more typical of inflammatory arthritis. D. Joint deformities are more likely to occur in later stages of osteoarthritis, not early stages. 99. Which of the following is a common comorbidity seen in patients with osteoarthritis? A. Hypertension. B. Asthma. C. Diabetes. D. Gout. Answer: A. Hypertension. Rationale: hypertension is a common comorbidity in patients with osteoarthritis, particularly in older adults. B. Asthma is not commonly associated with osteoarthritis. C's. Diabetes is another potential comorbidity, but is not as directly associated as hypertension. D. Gout is a different type of arthritis and is not typically seen with osteoarthritis. 100. Which of the following is an effective non-surgical treatment for osteoarthritis pain relief? A. Joint replacement surgery. B. Acetaminophen or NSAIDs. C. Corticosteroid injections. D. Physical immobilization. Answer: B. Acetaminophen or NSAIDs. Rationale: acetaminophen or NSAIDs are effective non-surgical treatments for managing osteoarthritis pain and inflammation. A. Joint replacement surgery is not a non-surgical treatment. C's corticosteroid injections are used in some cases, but are not first-line treatment. D. Physical immobilization is not recommended in osteoarthritis and may worsen symptoms. 101. What is the role of physical therapy in osteoarthritis management? A. To cure the condition. B. To increase flexibility and strengthen muscles around the joint. C. To completely restore joint cartilage. D. To reduce body weight. Answer: B. To increase flexibility and strengthen muscles around the joint. Rationale: physical therapy aims to increase joint flexibility and strengthen muscles to support the affected joint, improving function and reducing pain. A. Physical therapy cannot cure osteoarthritis. C. Physical therapy cannot restore cartilage, but helps manage symptoms. D. While weight loss is beneficial, it is not the primary goal of physical therapy. 102. Which of the following is the most common cause of secondary osteoarthritis? A. Trauma or injury to the joint. B. Obesity. C. Aging. D. Rheumatoid arthritis. Answer: A. Trauma or injury to the joint. Rationale: secondary osteoarthritis often develops due to joint trauma or previous injuries that lead to cartilage wear and degeneration. B. Obesity is a risk factor, but not the most common cause of secondary osteoarthritis. C. Aging is the most common cause of primary osteoarthritis, not secondary. D. Rheumatoid arthritis can lead to joint damage, but is not a common cause of secondary osteoarthritis. 103. Which of the following is an early sign of osteoarthritis in the hands? A. Swelling and redness. B. Nodules in the distal interphalangeal joints. C. Decreased range of motion. D. Joint warmth. Answer: B. Nodules in the distal interphalangeal joints. Rationale: the formation of nodules at the distal interphalangeal (DIP) joints is a characteristic early sign of osteoarthritis in the hands. A. Swelling and redness are more common in inflammatory arthritis. C. Decreased range of motion may occur later in the disease, but is not an early sign. D. Joint warmth is uncommon in osteoarthritis and more characteristic of inflammatory arthritis. 104. Which of the following is a common side effect of long-term corticosteroid use in osteoarthritis treatment? A. Osteoporosis. B. Joint degeneration. C. Cartilage regeneration. D. Decreased blood pressure. Answer: A. Osteoporosis. Rationale: long-term corticosteroid use can lead to osteoporosis, increasing the risk of bone fractures. B. Corticosteroids do not cause joint degeneration, but can provide temporary symptom relief. C. Corticosteroids do not regenerate cartilage. D. Corticosteroids typically cause an increase in blood pressure, not a decrease. 105. Which of the following is the best first step in managing osteoarthritis of the knee? A. Surgery. B. Weight loss and exercise. C. Opioid medications. D. Joint fusion. Answer: B. Weight loss and exercise. Rationale: the first step in managing knee osteoarthritis is weight loss and exercise to reduce joint stress and improve function. A. Surgery is not the first step. Conservative management is preferred initially. C. Opioid medications are not recommended as first-line treatment for osteoarthritis due to their risks. D. Joint fusion is a surgical option typically considered only in advanced cases. 106. What is the role of joint injections with hyaluronic acid in osteoarthritis? A. To treat infection. B. To provide lubrication and reduce pain. C. To cure osteoarthritis. D. To reverse cartilage loss. Answer: B. To provide lubrication and reduce pain. Rationale: Hyaluronic acid injections help provide lubrication in the joint, reducing pain and improving mobility in osteoarthritis. A. Joint injections with hyaluronic acid are not used to treat infection. C. Hyaluronic acid does not cure osteoarthritis. D. Hyaluronic acid does not reverse cartilage loss, but helps alleviate symptoms. 107. What is a common complication of advanced osteoarthritis? A. Systemic lupus erythematosus. B. Joint deformities and disability. C. Sickle cell anemia. D. Osteoporosis. Answer: B. Joint deformities and disability. Rationale: advanced osteoarthritis can lead to joint deformities and significant disability due to the loss of cartilage and joint function. 8. Systemic lupus erythematosus is unrelated to osteoarthritis. C. Sickle cell anemia is not associated with osteoarthritis. D. Osteoporosis is a different condition that affects bone density, not osteoarthritis. 108. Which of the following is a typical radiological feature of osteoarthritis? A. Increased joint space. B. Bone spurs and joint space narrowing. C. Elevated bone density. D. Soft tissue swelling. Answer: B. Bone spurs and joint space narrowing. Rationale: radiographs of osteoarthritis typically show joint space narrowing and the presence of bone spurs, osteophytes. A. Increased joint space is not typical of osteoarthritis and may indicate a different condition. C. Osteoarthritis typically shows reduced bone density, not elevated bone density. D. Soft tissue swelling is more commonly seen in inflammatory arthritis than in osteoarthritis. 109. Which of the following is a risk factor for developing hip osteoarthritis? A. High-impact sports. B. Hip dysplasia. C. Overuse of joint injections. D. Calcium deficiency. Answer: B. Hip dysplasia. Rationale: hip dysplasia, a congenital malformation of the hip joint, is a known risk factor for developing osteoarthritis. A. High-impact sports may increase the risk of joint injury, but are not a primary risk factor. C's overuse of joint injections is not a significant risk factor for osteoarthritis. D's calcium deficiency primarily affects bone density and is not a primary risk factor for osteoarthritis. 110. Which of the following treatments is most appropriate for early-stage osteoarthritis? A. Joint replacement surgery. B. Weight management and physical therapy. C. Opioid medications. D. Corticosteroid injections. Answer: B. Weight management and physical therapy. Rationale: early-stage osteoarthritis is best managed with weight management and physical therapy to reduce stress on joints and improve function. A. Joint replacement surgery is typically reserved for advanced stages. C. Opioid medications are not recommended for early-stage osteoarthritis due to risks. D. Corticosteroid injections may be used in some cases, but are not typically first-line treatment for early-stage osteoarthritis. 111. Which of the following is a common physical examination finding in osteoarthritis? A. Tenderness to palpation over the joint. B. Warmth and redness over the joint. C. Decreased muscle tone around the joint. D. Increased joint flexibility. Answer: A. Tenderness to palpation over the joint. Rationale: tenderness over the joint is a common physical finding in osteoarthritis. B. Warmth and redness are more characteristic of inflammatory arthritis like rheumatoid arthritis. C. Decreased muscle tone is not a typical feature of osteoarthritis. Muscle weakness may occur, but not decreased tone. D. Osteoarthritis typically causes decreased joint flexibility, not increased. 112. What is the primary goal of pharmacological treatment for osteoarthritis? A. To completely cure the disease. B. To reduce pain and inflammation. C. To reverse cartilage damage. D. To prevent joint degeneration. Answer: B. To reduce pain and inflammation. Rationale: the primary goal of pharmacological treatment for osteoarthritis is to reduce pain and inflammation. A. Osteoarthritis cannot be cured pharmacologically, as it is a degenerative disease. C. Pharmacological treatments do not reverse cartilage damage, but help manage symptoms. D. Preventing joint degeneration is a long-term goal, but treatment mainly focuses on symptom relief. 113. Which of the following is most commonly used for long-term pain management in osteoarthritis? A. Acetaminophen. B. Opioids. C. NSAIDs, non-steroidal anti-inflammatory drugs. D. Corticosteroid injections. Answer: C. NSAIDs, non-steroidal anti-inflammatory drugs. Rationale: NSAIDs are commonly used for long-term pain management in osteoarthritis to reduce inflammation and provide pain relief. A. Acetaminophen is used for mild pain relief, but does not address inflammation. B. Opioids are generally avoided in osteoarthritis management due to their addictive properties and side effects. D. Corticosteroid injections are used for short-term relief, but are not for long-term management. 114. Which joint is most commonly affected by osteoarthritis in the hands? A. Proximal interphalangeal joint. B. Distal interphalangeal joint. C. Metacarpophalangeal joint. D. Radiocarpal joint. Answer: B. Distal interphalangeal joint. Rationale: the distal interphalangeal (DIP) joint is most commonly affected by osteoarthritis in the hands, leading to the formation of Heberden's nodes. A. The proximal interphalangeal (PIP) joints may also be affected, but less frequently. C. The metacarpophalangeal (MCP) joints are typically affected in rheumatoid arthritis, not osteoarthritis. D. The radiocarpal joint is part of the wrist, and osteoarthritis there is less common. 115. What type of arthritis is osteoarthritis often confused with due to similar symptoms? A. Rheumatoid arthritis. B. Gout. C. Septic arthritis. D. Psoriatic arthritis. Answer: A. Rheumatoid arthritis. Rationale: osteoarthritis is often confused with rheumatoid arthritis because both can cause joint pain and stiffness, but the underlying causes and symptoms differ. B. Gout presents with sudden, severe attacks of pain, often in the big toe, and is not typically confused with osteoarthritis. C. Septic arthritis is characterized by joint infection and acute pain, which is different from osteoarthritis. D. Psoriatic arthritis also affects joints, but is associated with psoriasis. 116. Which of the following lifestyle modifications is most beneficial for osteoarthritis management? A. Smoking cessation. B. Weight loss. C. Increased alcohol consumption. D. High-intensity aerobic exercise. Answer: B. Weight loss. Rationale: weight loss is one of the most beneficial lifestyle modifications for osteoarthritis, as it reduces joint stress, particularly in weight-bearing joints like the knees and hips. A. Smoking cessation is important for overall health, but does not directly manage osteoarthritis. C. Increased alcohol consumption may have negative effects and does not benefit osteoarthritis. D. High-intensity aerobic exercise may put too much strain on the joints in osteoarthritis and is generally not recommended. 117. What is the primary role of physical therapy in the management of osteoarthritis? A. To cure the disease. B. To reduce pain and improve joint function. C. To reverse cartilage damage. D. To promote joint immobilization. Answer: B. To reduce pain and improve joint function. Rationale: physical therapy helps reduce pain and improve joint function by strengthening muscles around the affected joints and increasing flexibility. A. Physical therapy cannot cure osteoarthritis. C. Physical therapy does not reverse cartilage damage, but can help manage symptoms. D. Joint immobilization is not recommended for osteoarthritis, as movement and exercise are important for maintaining joint function. 118. Which of the following is a common sign of advanced osteoarthritis? A. Complete loss of joint range of motion. B. Joint deformities and misalignment. C. Persistent fever. D. Elevated white blood cell count. Answer: B. Joint deformities and misalignment. Rationale: advanced osteoarthritis often leads to joint deformities and misalignment due to cartilage loss and bone changes. A. Complete loss of range of motion is less common and may occur late in the disease. C's persistent fever is not associated with osteoarthritis. It suggests an infection or inflammatory condition. D. An elevated white blood cell count is not typical of osteoarthritis, but may be seen in infections or inflammatory arthritis. 119. Which of the following is a complication of long-term NSAID use in osteoarthritis patients? A. Osteoporosis. B. Gastrointestinal bleeding. C. Joint infections. D. Increased joint mobility. Answer: B. Gastrointestinal bleeding. Rationale: long-term NSAID use can cause gastrointestinal bleeding and other gastrointestinal problems, especially in older adults. A. Osteoporosis is not a typical complication of NSAID use, but may be linked to corticosteroids. C. Joint infections are not caused by NSAIDs, but may occur after joint surgery. D. NSAIDs do not increase joint mobility. They help manage pain and inflammation. 120. Which of the following is the most common treatment for moderate to severe osteoarthritis pain? A. Joint replacement surgery. B. Opioid medications. C. NSAIDs or acetaminophen. D. Corticosteroid injections. Answer: C. NSAIDs or acetaminophen. Rationale: NSAIDs and acetaminophen are commonly used to manage moderate to severe osteoarthritis pain. A. Joint replacement surgery is typically reserved for advanced cases of osteoarthritis. B. Opioids are not recommended for osteoarthritis due to their potential for addiction and side effects. D. Corticosteroid injections may be used for short-term relief, but are not the primary treatment for ongoing pain management. 121. Which of the following medications is often used as an adjunct for pain relief in osteoarthritis? A. Methotrexate. B. Gabapentin. C. Celecoxib. D. Prednisone. Answer: C. Celecoxib. Rationale: celecoxib is a COX-2 inhibitor that can be used for pain relief in osteoarthritis, particularly in cases where NSAIDs may not be suitable. A. Methotrexate is used for autoimmune conditions like rheumatoid arthritis. B. Gabapentin is used for nerve-related pain, not typically for osteoarthritis. D. Prednisone is a corticosteroid that is generally not first-line treatment for osteoarthritis and is reserved for inflammation-related conditions. 122. What is the most appropriate intervention for patients with severe osteoarthritis who have not responded to conservative treatments? A. Physical therapy. B. Joint replacement surgery. C. Lifestyle changes. D. Joint aspiration. Answer: B. Joint replacement surgery. Rationale: for patients with severe osteoarthritis who do not respond to conservative treatments, joint replacement surgery is often the most appropriate intervention. A. Physical therapy is effective for mild to moderate osteoarthritis, but may not be sufficient in severe cases. C. Lifestyle changes such as weight loss can be helpful, but are usually not enough for severe osteoarthritis. D. Joint aspiration may help relieve symptoms in certain cases, but does not address the underlying condition. 123. Which of the following is a potential benefit of using topical analgesics for osteoarthritis? A. They have fewer systemic side effects. B. They reverse cartilage degeneration. C. They increase joint mobility. D. They cure osteoarthritis. Answer: A. They have fewer systemic side effects. Rationale: topical analgesics, such as creams or gels, provide pain relief with fewer systemic side effects compared to oral medications. B. Topical analgesics do not reverse cartilage degeneration. C. Topical analgesics help with pain, but do not directly increase joint mobility. D. No medication can cure osteoarthritis, but topical analgesics may help alleviate pain. 124. Which of the following factors is most likely to accelerate the progression of osteoarthritis? A. Regular exercise. B. Joint injury or trauma. C. Proper weight management. D. Use of physical therapy. Answer: B. Joint injury or trauma. Rationale: joint injury or trauma can accelerate the progression of osteoarthritis by increasing wear and tear on the cartilage. A. Regular exercise, when done appropriately, can help manage osteoarthritis symptoms and slow progression. C's proper weight management helps reduce joint stress and can slow disease progression. D. Physical therapy can improve function and alleviate symptoms, which may help slow progression. 125. What is the primary purpose of using joint protection techniques in osteoarthritis management? A. To increase joint flexibility. B. To reduce pain and prevent further joint damage.
C. To cure the disease.
D. To promote physical activity. Answer: B. To reduce pain and prevent further joint damage. Rationale: joint protection techniques aim to reduce pain and minimize further joint damage by promoting proper posture, using assistive devices, and avoiding excessive stress on affected joints. A. Joint protection techniques do not primarily focus on increasing joint flexibility, though they may help. C. Joint protection techniques do not cure osteoarthritis, but help manage it. D. Physical activity is encouraged, but joint protection techniques are specifically designed to reduce strain on joints. 126. Which of the following can contribute to the development of osteoarthritis in the knee? A. Excessive physical activity without rest. B. Sedentary lifestyle. C. Increased age. D. Obesity. Answer: D. Obesity. Rationale: obesity is a major risk factor for developing knee osteoarthritis due to the increased weight-bearing load on the joints. A. Excessive physical activity without rest can lead to injury, but is not the primary cause of osteoarthritis. B. A sedentary lifestyle can contribute to muscle weakness and joint stress, but is less of a direct risk factor than obesity. C. Increased age is a risk factor, but obesity plays a larger role in joint wear in osteoarthritis. 127. In which of the following cases would a patient with osteoarthritis most likely benefit from surgical intervention? A. Mild symptoms with good function. B. Severe joint pain and functional limitations. C. Joint stiffness without pain. D. Acute injury to the joint. Answer: B. Severe joint pain and functional limitations. Rationale: surgical intervention, such as joint replacement, is typically considered when osteoarthritis causes severe pain and significant functional limitations. A. Mild symptoms with good function usually do not require surgery and can be managed conservatively. C. Joint stiffness without pain is not an indication for surgery. D. Acute injury is a separate issue and would be treated based on the nature of the injury. 128. Which of the following is most likely to occur in a patient with advanced osteoarthritis? A. Increased range of motion. B. Joint deformities and immobility. C. Reversal of cartilage damage. D. Resolution of pain without treatment. Answer: B. Joint deformities and immobility. Rationale: in advanced osteoarthritis, joint deformities and immobility are common due to the destruction of cartilage and bone changes. A. Increased range of motion is unlikely in advanced osteoarthritis. Stiffness typically worsens. C's cartilage damage is irreversible, and it does not regenerate. D. Pain is unlikely to resolve without treatment, and osteoarthritis typically leads to progressive symptoms. 129. Which of the following lifestyle changes can help prevent the progression of osteoarthritis? A. Smoking cessation. B. Regular weight-bearing exercise. C. Increased salt intake. D. High-fat diet. Answer: A. Smoking cessation. Rationale: smoking cessation is important for overall joint health, as smoking can impair blood flow and worsen joint damage. B. While regular exercise is beneficial, excessive weight-bearing exercise can exacerbate osteoarthritis symptoms. C. Increased salt intake can contribute to inflammation and is not helpful for osteoarthritis. D. A high-fat diet can promote inflammation and worsen osteoarthritis. 130. What is the primary treatment for acute exacerbations of osteoarthritis pain? A. Physical therapy. B. NSAIDs or acetaminophen. C. Joint replacement surgery. D. Disease-modifying antirheumatic drugs, DMARDs. Answer: B. NSAIDs or acetaminophen. Rationale: NSAIDs or acetaminophen are typically used to manage acute pain in osteoarthritis exacerbations. A. Physical therapy is important for long-term management, but does not address acute exacerbations. C. Joint replacement surgery is not used for acute pain. It is reserved for advanced cases. D. DMARDs are used for inflammatory arthritis, not osteoarthritis. 131. Which of the following is an appropriate nursing intervention for a patient with osteoarthritis experiencing pain? A. Apply heat to the affected joint. B. Encourage complete bed rest. C. Restrict fluid intake. D. Immobilize the joint with a brace. Answer: A. Apply heat to the affected joint. Rationale: applying heat to the affected joint can help reduce pain and stiffness in osteoarthritis by improving blood flow and relaxing muscles. B's. Complete bed rest is generally not recommended as it can lead to stiffness and loss of mobility. C. Restricting fluid intake is not necessary for osteoarthritis and could lead to dehydration. D. Immobilizing the joint is not recommended. Movement and exercise help maintain joint function. 132. Which of the following diagnostic tests is most commonly used to confirm the diagnosis of osteoarthritis? A. X-ray. B. MRI. C. Blood tests. D. Joint aspiration. Answer: A. X-ray. Rationale: X-ray imaging is the most commonly used diagnostic test for osteoarthritis, as it can show characteristic joint changes such as narrowed joint spaces, osteophytes, and subchondral sclerosis. B. MRI may be used in more advanced cases, or when soft tissue damage is suspected but is not typically used for initial diagnosis. C's. Blood tests are not used to diagnose osteoarthritis, although they may help rule out other conditions. D. Joint aspiration is typically used to rule out infection or other inflammatory conditions, not to diagnose osteoarthritis. 133. Which of the following is the most common complication of osteoarthritis? A. Osteoporosis. B. Joint deformities. C. Bone fractures. D. Neuropathy. Answer: B. Joint deformities. Rationale: joint deformities are a common complication of osteoarthritis due to the progressive loss of cartilage and changes in bone structure. A. Osteoporosis is not typically a direct complication of osteoarthritis, but may occur in individuals with limited mobility or weight-bearing activity. C's. Bone fractures are not a typical complication of osteoarthritis, although individuals with joint instability may be at increased risk. D. Neuropathy is not a direct complication of osteoarthritis, but may occur in some cases due to associated conditions like diabetes. 134. Which of the following interventions is most likely to prevent joint deformities in osteoarthritis? A. Joint immobilization. B. Weight loss and regular exercise. C. Complete rest of affected joints. D. High-dose corticosteroid use. Answer: B. Weight loss and regular exercise. Rationale: weight loss and regular exercise help reduce stress on the joints, improve muscle strength, and increase flexibility, which can prevent or delay joint deformities in osteoarthritis. A. Joint immobilization is not recommended, as it can cause stiffness and further joint deterioration. C's. Complete rest is not advised for osteoarthritis. Some level of activity is necessary to maintain joint function. D. High-dose corticosteroids may be used for short-term flare-ups, but do not prevent joint deformities and have significant side effects with long-term use. 135. Which of the following is the primary reason osteoarthritis occurs in weight-bearing joints? A. Increased cartilage thickness. B. Joint overuse leading to cartilage breakdown. C. Increased joint flexibility. D. Inflammatory response. Answer: B. Joint overuse leading to cartilage breakdown. Rationale: osteoarthritis occurs in weight-bearing joints due to the constant pressure placed on them, which leads to cartilage breakdown over time. A. Cartilage thickening is not a feature of osteoarthritis. It tends to thin and deteriorate. C. Increased joint flexibility is not associated with osteoarthritis. It typically causes joint stiffness. D. Osteoarthritis is not primarily caused by an inflammatory response. It is a degenerative process. 136. Which of the following is a potential side effect of long-term NSAID use in osteoarthritis treatment? A. Increased bone density. B. Gastric ulcers. C. Improved joint function. D. Reversal of cartilage damage. Answer: B. Gastric ulcers. Rationale: long-term use of NSAIDs can increase the risk of gastric ulcers and gastrointestinal bleeding, especially in older adults. Age NSAIDs do not affect bone density. Corticosteroids are more commonly associated with decreased bone density. C. NSAIDs may provide pain relief, but do not improve joint function. D. NSAIDs do not reverse cartilage damage. They only manage symptoms of pain and inflammation. 137. In osteoarthritis, the breakdown of which structure leads to pain and stiffness in affected joints? A. Ligaments. B. Cartilage. C. Synovium. D. Tendons. Answer: B. Cartilage. Rationale: in osteoarthritis, the breakdown of cartilage leads to pain, stiffness, and loss of joint function as the cartilage no longer protects the bones from friction. A. Ligaments provide joint stability, but their breakdown is not the primary cause of osteoarthritis pain. C. The synovium may become inflamed, but cartilage degeneration is the main cause of symptoms. D. Tendons may be affected in some cases, but are not the primary structure involved in osteoarthritis. 138. Which of the following is a common radiological finding in osteoarthritis? A. Joint effusion. B. Bone spurs, osteophytes. C. Calcification of soft tissues. D. Decreased bone density. Answer: B. Bone spurs, osteophytes. Rationale: bone spurs or osteophytes are a common finding in osteoarthritis, particularly at the margins of affected joints. A. Joint effusion may occur, but it is not specific to osteoarthritis and may be seen in other conditions. C. Calcification of soft tissues is not a typical radiological finding in osteoarthritis. D. Osteoarthritis typically leads to increased bone density in certain areas, like subchondral sclerosis, but not decreased bone density. 139. Which of the following is a key characteristic of the pain in osteoarthritis? A. It is usually constant and severe. B. It improves with activity. C. It is associated with fever. D. It worsens with activity and improves with rest. Answer: D. It worsens with activity and improves with rest. Rationale: in osteoarthritis, pain typically worsens with activity due to increased stress on the affected joints and improves with rest as the joints have time to recover. 8. Pain in osteoarthritis can vary in intensity, but is not usually constant or severe. B. Pain usually worsens with activity, not improves. C. Fever is not a characteristic of osteoarthritis pain. Fever suggests an inflammatory or infectious process. 140. Which of the following is a common symptom of osteoarthritis in the hip joint? A. Sharp, stabbing pain with movement. B. Morning stiffness lasting more than 1 hour.
C. Pain in the groin or thigh.
D. Warmth and redness over the joint. Answer: C. Pain in the groin or thigh. Rationale: in hip osteoarthritis, pain is often felt in the groin or thigh area due to the location of the hip joint. A sharp, stabbing pain is not typical of osteoarthritis. The pain is usually aching or throbbing. B. Morning stiffness in osteoarthritis generally lasts less than 30 minutes, not over 1 hour. D. Warmth and redness are more characteristic of inflammatory arthritis like rheumatoid arthritis. 141. Which of the following is the most effective way to manage osteoarthritis pain in the knee? A. Use of a knee brace. B. Weight loss and physical therapy. C. Joint aspiration. D. Long-term opioid use. Answer: B. Weight loss and physical therapy. Rationale: weight loss and physical therapy are the most effective ways to manage knee osteoarthritis pain by reducing joint stress and strengthening muscles around the joint. A knee brace can provide temporary support but does not address the underlying cause of pain. C. Joint aspiration is used to remove excess fluid but does not treat the underlying osteoarthritis. D. Long-term opioid use is generally avoided due to potential side effects and the risk of addiction. 142. What is the most appropriate intervention for a patient with osteoarthritis and mild morning stiffness? A. Bed rest for several days. B. Application of cold compresses. C. Encourage regular exercise. D. Prescribe opioid analgesics. Answer: C. Encourage regular exercise. Rationale: regular exercise can help alleviate mild morning stiffness by improving joint flexibility, strength, and overall function. Bed rest is not recommended, as movement is important for joint health. B. Cold compresses may help with acute inflammation but are not as effective for stiffness management. D. Opioid analgesics are not appropriate for mild morning stiffness. Non-pharmacological interventions should be prioritized. 143. Which of the following is the main cause of pain in osteoarthritis? A. Inflammation of the synovium. B. Breakdown of cartilage. C. Infection of the joint. D. Muscle spasms around the joint. Answer: B. Breakdown of cartilage. Rationale: the primary cause of pain in osteoarthritis is the breakdown of cartilage, which leads to bone-on-bone contact, friction, and inflammation. A. While synovial inflammation may occur, it is not the primary cause of pain. C. Joint infection is rare in osteoarthritis and is not the main cause of pain. D. Muscle spasms may occur but are secondary to the primary issue of cartilage degeneration. 144. Which of the following can reduce the risk of osteoarthritis in the knee? A. Increasing body weight. B. Strengthening the quadriceps muscle. C. Reducing physical activity. D. Avoiding weight-bearing exercises. Answer: B. Strengthening the quadriceps muscle. Rationale: strengthening the quadriceps muscle helps support the knee joint and reduces the risk of osteoarthritis by improving stability and reducing stress on the joint. A. Increasing body weight increases the risk of osteoarthritis due to the added load on the knee. C. Physical activity is beneficial for joint health when done appropriately. D. Weight-bearing exercises, when performed correctly, can be helpful in managing osteoarthritis and improving joint function. 145. Which of the following is a key feature of osteoarthritis compared to rheumatoid arthritis? A. Osteoarthritis is primarily an inflammatory disease. B. Osteoarthritis affects smaller joints more often. C. Osteoarthritis is characterized by joint degeneration rather than inflammation. D. Osteoarthritis occurs in a symmetrical pattern. Answer: C's. Osteoarthritis is characterized by joint degeneration rather than inflammation. Rationale: osteoarthritis is a degenerative joint disease characterized by cartilage breakdown, while rheumatoid arthritis is an inflammatory condition. A. Rheumatoid arthritis is primarily an inflammatory disease, not osteoarthritis. B. Osteoarthritis more commonly affects larger joints like the hips and knees. D. Osteoarthritis typically affects joints asymmetrically, whereas rheumatoid arthritis usually presents in a symmetrical pattern. 146. Which of the following is a common risk factor for developing osteoarthritis? A. Hypothyroidism. B. Obesity. C. Chronic alcoholism. D. Smoking. Answer: B. Obesity. Rationale: obesity is a major risk factor for osteoarthritis, especially in weight-bearing joints like the knees and hips, as excess weight puts increased stress on the joints. A. Hypothyroidism can contribute to other conditions, but it is not a primary risk factor for osteoarthritis. C's. Chronic alcoholism does not directly contribute to osteoarthritis, though it can cause other health issues. D. Smoking is a risk factor for many conditions, but is not directly linked to osteoarthritis. 147. In osteoarthritis, which of the following structures is most commonly affected by the disease? A. Tendons. B. Synovium. C. Cartilage. D. Ligaments. Answer: C. Cartilage. Rationale: osteoarthritis primarily affects the cartilage, leading to its breakdown and subsequent pain, stiffness, and reduced joint function. A. Tendons are not primarily affected in osteoarthritis. B. The synovium may be mildly inflamed in some cases, but cartilage degeneration is the main issue. D. Ligaments are typically not the primary structures affected by osteoarthritis, although they may become strained due to joint instability. 148. What is the hallmark of osteoarthritis on X-ray imaging? A. Joint effusion. B. Decreased joint space.
C. Bone cysts.
D. Increased bone density. Answer: B. Decreased joint space. Rationale: decreased joint space is the hallmark of osteoarthritis seen on X-ray imaging, indicating cartilage loss and the resulting bone-on-bone contact. A. Joint effusion may occur but is not a hallmark feature of osteoarthritis. C. Bone cysts may develop but are not the defining characteristic. D's osteoarthritis often results in subchondral sclerosis, not increased bone density, throughout the joint. 149. Which of the following is an appropriate pharmacological treatment option for managing pain in osteoarthritis? A. Acetaminophen. B. Methotrexate. C. Penicillin. D. Prednisone. Answer: A. Acetaminophen. Rationale: acetaminophen is commonly used to manage mild to moderate pain in osteoarthritis, as it is effective for pain relief and has fewer side effects compared to other medications. B. Methotrexate is primarily used for rheumatoid arthritis, not osteoarthritis. C's penicillin is an antibiotic and not used to treat osteoarthritis. D's prednisone may be used for short-term inflammation, but is not a first-line treatment for osteoarthritis due to potential side effects with long-term use. 150. Which of the following is a characteristic finding in osteoarthritis of the hand? A. Heberden's nodes. B. Rheumatoid nodules. C's boutonniere deformity. D. Swan neck deformity. Answer: A. Heberden's nodes. Rationale: Heberden's nodes are bony swellings that form at the distal interphalangeal (DIP) joints and are a characteristic feature of osteoarthritis. B. Rheumatoid nodules are associated with rheumatoid arthritis, not osteoarthritis. C's boutonniere deformity is seen in rheumatoid arthritis, not osteoarthritis. D. Swan neck deformity is also a characteristic of rheumatoid arthritis, not osteoarthritis.